Barry. It's very nice to be able to talk with everybody here today. I'm very excited to be able to do this. As Barry said, I am a head and neck surgeon at Nebraska Medicine. We are currently fortunate to be the only program in the state of Nebraska who is offering the Inspire device. And you'll hear from at least one individual who's had the device placed and is doing wonderfully. And we hope the folks who are on the call today may find some benefit to something similar. So I'm just going to start by giving a basic overview about sleep apnea. Many of you on the Zoom meeting likely know a bit about the diagnosis, but we'll talk a bit in broad terms and then go over some specifics related to the device itself, and certainly open things up to questions, and we'll keep this relatively informal. So as we're going along, please use the Q&A button down below if there's anything that comes to mind. We'll start here just by describing sleep apnea. So OSA is really a process by which the airway is becoming obstructed, particularly at night when you go to sleep and muscle tone around the upper airway is going to be diminished. And so oftentimes, due to the action of gravity and the decreased muscle tone, the tongue itself or the soft palate can both cause obstructive events at night. And Barry's going to point there to the tongue, which is, as you know, located in the mouth and also the back of the throat, and then the soft palate, which connects to the roof of the mouth, but can actually be redundant enough to cause some obstruction as well. And that blockage of airflow leads to obstructive events or decreased airflow at night, and really leads to the symptoms that we see with sleep apnea. Now, over 20 million Americans are affected by moderate to severe OSA. And we have quantitative or numerical data to tell us what qualifies as moderate to severe OSA. So when you get a sleep study, we're looking at a marker called an apnea-hypopnea index to calculate who are the patients at increased risk and who are the patients that qualify in this group. But that's certainly something we can easily tell based on your sleep study. Barry, if you want to click ahead there. So this is just a nice graphic showing us what exactly apnea looks like. And so if we were to basically monitor the oxygen levels in your blood over time during an apneic episode, what we find is that when you're obstructed, when you're not able to get in airflow into the lungs, the oxygen number in the blood starts this slow decline. And the point where it's lowest, we'll often be able to see that on your sleep study. But for example, a normal individual should have oxygen saturation numbers at rest in the high 90% range. Well, during an obstruction, we can see numbers drop to the mid 80% range, 74%. Certainly even lower than that. And as the numbers drop continually throughout the night, that means that your brain is not getting the sort of blood flow and oxygen flow really that it needs, and so we can run into some issues there. We'll go ahead and move to the next slide here. So what are the consequences of these obstructive events? Well, some of this is really easy to tell, right? Nighttime sleep issues are going to lead to daytime fatigue, diminished productivity. Many patients walk around and sort of feel like they're in a brain fog, that they're cognitively not as sharp as they used to be. Certainly anybody who has a bed partner knows the bed partner gets pretty irritated pretty quickly when you have issues with snoring that are undiagnosed or untreated. There is a theoretical risk of accidents, just from being out and about and driving around, or if you're somebody who uses heavy machinery at work. Certainly, there are a number of work-related accidents that can be due to sleep apnea. And then, of course, the heart and brain issues we talked about due to this chronic issue with oxygen levels in the blood. And so there are some very, very real long-term health effects beyond just the fatigue and productivity type issues that many people associate with sleep apnea. We'll move to the next slide here, Barry. So most of us are aware that CPAP tends to be the first line therapy for sleep apnea. And one thing that almost any sleep specialist will tell you is that CPAP is tremendously effective. We know it works, and I don't think there's a surgeon out there who will tell you that it isn't effective. The problem with CPAP, and those of you who have used it know, is it's very cumbersome and very difficult to be compliant. It can be claustrophobia inducing. The machines can be loud to some degree. They can interfere with your position in the bed. If you like to sleep on your stomach, for example, that's going to be very difficult. They can irritate your bed partner. It's large enough and cumbersome enough that it can be difficult to travel with. And so because of all these reasons, CPAP compliance tends to be relatively poor. And so that's why Inspire has been looking for an alternative solution. You can go to the next slide. So prior to hypoglossal nerve stimulation, there were still some surgical options available for sleep apnea, or perhaps I should say non-CPAP related options. The first up here is an oral appliance, and that is essentially a custom device that could be made by either your dentist or oral surgeon. And the intended benefit of this device that you would wear at night is that it's going to push the jaw slightly forward. And what that ultimately can do is move the tongue forward slightly. Now, that is a static process, meaning it's not related to your breathing at all. It pushes the jaw forward at night, and then you take the device off during the day. However, it can alter the position of the jaw and the teeth over time. And of course, it's a bit uncomfortable. You can see the device here on the mold and can imagine having to wear that every night can be sometimes even more cumbersome or more annoying to deal with than the CPAP itself. There are also other surgical options that are what we would consider to be anatomy altering. So that is, if we were to watch you when you sleep, for example, and notice that you had really large tonsils that were obstructing your airway at night, or the soft palate was obstructing the airway. These areas can be addressed surgically to make them smaller to help with the obstruction. However, these sorts of procedures tend to be very painful because we're operating in the throat, and also they're not reversible. Once the procedure's done, that's it. The anatomy has been basically altered and cannot be undone. Can we go to the next slide? So this is a picture of the Inspire device. The device is essentially created to open up the airway in a manner that's not invasive as far as the airway itself is concerned. It's a safe outpatient procedure. The picture on the left side of your screen that you see there is actually the size of the generator. That is the battery pack essentially that gets placed just below the collarbone. And you can see how small it is. It's relatively thin, relatively small. Lisa's holding it up there, if you can see in the panel window. It's pretty tiny, and so it's not cumbersome at all. And it works wirelessly. So once the implant is in, you as the patient, when you go home at night, are able to turn it on and off through this little wireless remote that this gentleman is holding in his right hand. And we'll explain a little bit more about that, I think, a few slides from now. We'll have you go ahead and move on. So the first point here is Inspire is inserted through 3 small incisions. And if you had talked to me about a month ago, I would have said that's correct. But it seems like we've just gotten FDA approval now to implant the device through 2 incisions. And so we essentially make 2 incisions, one underneath the jaw, typically on the right side, and another second incision just below the collarbone on the right side. And we've gotten rid of this lower incision where you see it says senses breathing. That lower sensor incision, which used to be between the ribs, is now gone. And we place that through an upper incision here where the generator goes in the upper part of the chest. And the reason I'm bringing this up at all is the 2 incision technique is a lot less surgery. So the surgical time is typically quicker. And also that rib incision tends to be the more painful part of the procedure. And so the postoperative recovery at this point should be quite rapid. And you should be back to normal activities, normal function within a few days. And many of our patients that we've implanted over the last year have simply been on Tylenol in the postoperative period. So this should further help that. Now, a lot of folks ask me, well, once you implant the generator, how long does this device last? Well, the battery should be lasting somewhere between 10 to 11 years. So quite a long time. Well, what happens when the battery runs out? Well, at 11 or 12 years, if the device goes out, we simply have to replace the generator itself. And so these wires that are traveling to the nerves, to the tongue, and traveling to sense the breathing, those wires are not necessarily needing to be changed, just the generator itself. And through a short 30-minute outpatient procedure, we can get that new battery in and get everything plugged back in and working effectively. And so that's hopefully something that would not need to be done too frequently. MRIs are safely performed on patients with the Inspire device. The head, neck, and extremities can all be covered. We simply ask that you don't have any MRI done directly over the device itself. So the chest would have to be excluded, but usually that's not a huge issue. We'll move on to the next slide there. So after the procedure, in which we place the two wires, one to the nerve that controls tongue movement and one that senses your breathing pattern, you'll typically go home that day or the following morning, and we'll see you back in about a week to make sure there are no postoperative complications, you're healing well. If you're doing well at that time, we'll generally bring you back in about 3 to 4 weeks and turn on the device. And we'll do that in the clinic setting. So while you're awake, you'll be able to see what the device is doing. We'll be able to adjust parameters to make sure it's comfortable for you. And we establish those initial settings. Once we're happy with those initial settings, we'll teach you how to use the remote. And it's very simple. And I'm sure Lisa can talk to you about that towards the end of the slides here. She'll kind of explain just how simple and easy it is to use. It's a wireless remote. You'll turn it on at night. It has a built-in timer that allows you to go to sleep, whether that's 30 minutes or 45 minutes, depending on your routine. You go to sleep, the device kicks in. And the intention here is that every time you breathe in at night with the device on, the generator should be sending a small electrical signal to the tongue that tells it to move slightly forward. And that movement is enough to open up the airway and decrease the obstructive events. We'll go ahead to the next slide. Okay, so does this device work? Well, yes, it absolutely works, and we know that based on trial data that's been done looking at a number of patients with moderate to severe sleep apnea. And so if you look at the trial data and you were to take an average of how many obstructive events patients were having per hour, the average prior to surgery, prior to implant, was around 29 events per hour. And after implantation, this number dropped to 6.2. And so that's close to an 80% reduction in the number of obstructions per hour. And I would like to point out that in the adult population, having less than 5 obstructive events per hour is considered normal. And so these patients are almost getting to a point where we wouldn't even consider them as having sleep apnea, even mild sleep apnea at this point. And certainly that's low enough that many patients would not require CPAP therapy moving forward. We'll move on. So the other perhaps unintentional benefit of this is your bed partner may be a lot happier after this is in. If you ask the bed partners about snoring symptoms specifically, snoring and sleep apnea don't necessarily correlate one-to-one, but most would find that after the device is implanted, snoring goes down considerably. And so you can see bed partners reported 83% snoring rate before the implantation, and post-implant, only 10% were noted to be snoring, so about a 90% reduction there. We'll go on to the next slide. So patients seem to be satisfied with the device. They seem to be very compliant with it. They seem to like using it. And so if we look at survey data from the registries that are looking at patients who have been implanted, there are something like 16,000 patients worldwide now who have had the implant. And there are registries which are accruing patients to ask them how they're doing and how satisfied they are. About 94% will tell you that they're happy with the implantation and with how they're doing at home. And the average use per night is approaching around 6 hours. And so as opposed to CPAP, where it can be difficult to even get 2 or 3 or 4 hours of use per night, we find that many patients are getting at least close to a full night's rest with the device. Okay, so these clinical results have been out there for a number of years. So the FDA approved the Inspire device in 2014. So while we are the only program in the state right now offering this, the device has been field tested now for a number of years. And so there are at least 100 peer-reviewed medical publications that have come out, including in very prestigious journals like the New England Journal of Medicine. There is now 5-year follow-up data on the initial trial study that was done for FDA approval. And as I mentioned, this registry is accruing upwards of 5,000 patients. So we'll have a lot of good data longitudinally looking forward to make sure everybody is doing well with the device and not having any major issues. A question we often get asked at our clinic visits is, well, what about insurance coverage? Well, broadly, most insurance companies will cover the device provided we meet some basic requirements or basic parameters. And our clinic does a really nice job of helping, and so does the Inspire company, as far as making sure you meet requirements. And we do most of the legwork as far as talking to your insurance company and getting you prior authorization, provided you meet all of the medical criteria. Also important to know that Medicare does cover this, and many of the VA and military hospitals in the country. If you're a veteran, certainly we've had a number of patients on that front get the device, or at least be eligible for the device. Okay, so is Inspire right to you? I kind of alluded to the fact that you do need to meet some certain medical criteria. And so for us, that really means moderate to severe obstructive sleep apnea, as evidenced by a recent sleep study within the last 2 years. You're non-compliant or having difficulty using the CPAP device. It's okay to be slightly overweight, but we are trying to limit patients who have a significant body mass index, because that may lead to a benefit that's not quite seen even after implantation. And so we typically want your body mass index to fall within a certain number, which can be a little bit variable insurance company to insurance company. And then one of the important points here is, if you meet those initial criteria, we do have you get an airway anatomy exam. And that exam is done in the operating room. And essentially, we watch you sleep. We put you into a condition that mimics sleep with medication, and we watch and we see where the obstruction occurs. And if we can verify that the obstruction occurs around the back of the tongue and is not related to circumferential narrowing at the back of the throat, then you pass that exam and you're a good candidate for the device. And of course, we're not yet, I believe, implanting the pediatric population, and so the age over 22 is recommended, but down the line, that may be something that is done as well. So this last point here, just like I mentioned, a recent sleep study is necessary, usually for insurance coverage. And so within the last 2 years, if you have not had one, that may be something we talk about during the clinic visit. And we'll go ahead and move on. So the Inspire company has done a really nice job setting up a website with a lot of great patient information and safety information. I really encourage you, if you have time and have internet access, which I'm assuming you do if you're on this call, please go to inspiresleep.com. There's a full list of benefits and important safety information there. And you'll also get some access to our patient ambassador program. We have Lisa Gainey, who's with us from this program, who's going to talk to you a little bit about her experience. And I'll have Barry from Inspire just introduce her before she gives you, kind of her experience over the last, I guess it's been, year and a half or so now.
Thank you, Dr. Syed. Yes, we're very lucky to have Lisa with us this evening. Thank you so much, Lisa, for joining us and sharing kind of your Inspire journey with everyone that's online right now. I'll let you take it away, Lisa.
Sure. I'm happy to talk to you all. I am an Inspire ambassador. I received my device in October of 2019, as it says there. I was activated a little over a month later. And I've been using it ever since. And some information that may be interesting to you all. I mean, maybe you've experienced this. I snored, didn't think it was that big a deal. And then my husband finally sat me down and said, it's not the snoring, it's the fact that you stop breathing and I think you're dead. And then all of a sudden you gasp. He said, you have to sit up in bed like that and then go back to sleep. I wasn't waking up from that, so I didn't know it was happening, but it was waking him up. And then he said he had to watch to make sure I started breathing again, so he couldn't sleep. And I said, okay, fine, I'll go to the doctor. So I went through what many of you may have gone through, had a sleep study, was diagnosed with severe obstructive sleep apnea. My AHI was 44. And when the technicians tried different machines on me, when they put me on BiPAP and other machines, it got worse because it started to cause central apneas. And so they said, well, we'll do the CPAP. And they kept raising my pressure higher and higher. Maybe some of you have put on a mask and like it wants to blow off your face. I mean, we were up to a pressure of 20. I know that's not as high as it goes, but that's pretty high. And I was, my apnea was not being controlled. I still got very high numbers. Some nights I'd get a lower number. And I wore my CPAP religiously because I was convinced if I did what I was supposed to do, it would work. So this wasn't where I just couldn't stand it on my face. And like most of you, actually, I hated it on my face, but I wore it anyways because I wanted it to work and it didn't. And finally, my doctor, about the same time, my doctor said, I don't usually recommend surgery, but there's this special implant. Maybe it would help you. And then a friend of mine read about Inspire in the New York Times and also told me that. And another doctor that I saw referred me to a surgeon like Dr. Syed, who does, did Inspire surgeries. And I went through all the criteria. I met all the criteria and I had that endoscopy test to make sure my airway would work. And it was a piece of cake. That was a nice little nap and you're done. And then I had my surgery and the surgery was not very hard to recuperate from. It's not the worst surgery I've had by a long shot. I'm kind of a wimp with pain, so I did take the narcotics prescribed for a couple of days. And then I was on Tylenol, for another day or two. I went back to work in less than a week. It takes a while for things to heal, and I'm sure my camera is not good, but I bet you can't see what it looked like when I had the surgery. It looked like someone, I'll be honest, looked like somebody slashed my throat. It doesn't look nice right away. Be prepared. It's okay. It's gone. I mean, you can't really see my scar there. And as Dr. Said referred to, they're now only doing 2 incisions. But when I had mine, I did have the one on the ribs. And I have an incision right here, which my shirt kind of slips and shows. I don't even know if you can see it. There's nothing there anymore. My device is under there. A lot of people have asked me, can you feel it? Yes, I can feel the outline of it. Does it hurt? Nope. I can push on it. It doesn't hurt. It's this thing right here and it's sitting right there, if that helps to see it. And so before I had Inspire, when I would wake up in the morning, I would be in the mental fog that the doctor described to you earlier for hours. I mean, I had to get an accommodation at work so I could go into work late because when I woke up, I couldn't function. And it wasn't driving a car. I mean, I was doing finance work and I almost made some pretty bad, large dollar amount errors because I was so crazy in the morning. My husband said I was like a zombie. And so now that I have Inspire with it, I mean, when I wake up, I'm a little groggy like a lot of people. In 5 minutes, I can feel it. My brain is now clear. It's amazing. This remote they were talking about is really simple to use. It's even only got a couple of buttons on it. I mean, whether you're into technology or not, this is super easy to use. You push a button, it turns green to let you know something's going to happen. You put it up against your device, the Bluetooth turns it on. You turn it off with another button here, It's got levels on the back that your rep and doctor will work with you on determining what the appropriate levels are. Whoops, it just went off. And so I feel like Inspire is very supportive. They helped me with my insurance issues, and my insurance fully covered it. It's Blue Cross Blue Shield for what it's worth. And I feel like they have a website. They also have an app that you can put on your cell phone, that, on your mobile phone, that is super helpful. It answers a lot of questions. I was actually invited to help them further develop the app by providing some one-on-one feedback with the developers on, what we'd like to see as patients. And so they care what patients think. I mean, that's amazing to me. And I think at the also, if you are on social media, Facebook has a couple of Inspire patients groups. You don't have to have Inspire to get in the group. You can join because you want to hear what people say. And while I'll caution you that if everything's going perfectly, some people won't be on there, and the people who are having a little problem might be on there. There's still, almost everybody I've talked to has been satisfied and happy. And it's not an overnight thing. That's the other thing I'm supposed to remember to say. It's not like the doctor turns it on and you push the button and you're cured. They have to adjust it, just like you adjust CPAP settings, just like you learn or your body learns to do different things. It takes a while for them to fine tune it to the right exact level for you. And it's really important to be in touch with your doctor and your rep when you're thinking, oh no, I'm not sure if this is right. They're there for you. And it's really important. So I'm not sure what else to say, but I hope I've given you an idea about living with Inspire. It's super easy to travel. All you have to do is put this in your purse or your pocket or whatever. Makes it a lot easier. So.
Okay, great. Thank you very much, Lisa. I hope everybody got a little piece of what Lisa's life has been with after Inspire. And just going to the next slide here, I just wanted to give everybody that's watching some contact information. If you're interested in Inspire, or you want to make an appointment to see Dr. Syed in the office, if you've already been diagnosed with obstructive sleep apnea, or you're looking to get a sleep study done, you can go ahead and call the number that's listed on your screen, and they will be able to help you.